I was reading an article, and every year some academic institution comes up with the top 10 worst words of 2020, and you shouldn't use them again. And one of those was pivot. So I've tried to strike pivot from my vocabulary. The other word was, I wrote it down. It was something like, we're all in this together. But we are all in this together. So how am I not going to use that word in 2021? But we have a lot of resources on our website. And of course, here's a little graphic where we really ramped up our virtual meetings with meetings where we were sharing, people were sharing their stories. We ramped up our webinars, and we had many of them that dealt with COVID. We found that people were thrown into new situations, people who had to work at home and had to use these platforms like Zoom, needed communication access, students who all of a sudden needed to have captioning for their online courses. So we tried to, we not only came up with some of these resources on our own, but we worked together with other groups in the disability space, as well as the other groups that deal with hearing loss, to come up with some of these. Of course, as you know, our Walk for Hearing went virtual. And I love to tell the story. Last spring, very early on, our walk staff just knew immediately that we had to have a virtual walk. And this was before anybody was thinking that walks would be virtual, events would be virtual. And I remember this so vividly. I said to the staff, I said, well, how are you going to have a virtual walk? And they said, we don't know, but we'll figure it out. And they did with all of you. They figured it out. And I just am so proud of what people across the country did, you included, because the Westchester chapter is very much involved in the Walk for Hearing for many years. And I appreciate what you did to help make that happen. So we had chapter meetings that were held virtually, and we've started to have chapter leadership webinars. And of course, we had to have our convention virtual. And again, this year, we will be holding an online virtual convention. It was to be in San Diego the end of June, but we know that there's just not going to be a safe situation that makes any sense to bring people together from across the country. And we also know that even if it were the right environment to travel and be together, it's highly likely that the protocols for masks are still going to be in place. And I personally could not imagine having a convention for people with hearing loss where we had to wear masks. I mean, it just doesn't make sense. So again, this year, we will be having a virtual event. And let's just hope that we get back to our in-person chapter meetings, our in-person conventions. But I do think, COVID accelerated all this online offerings that we always wanted to do. And I think it's great. And I think even when we get back to in-person meetings, I think there's always going to be a place for virtual chapter meetings, for virtual offerings, virtual conventions. And I think just the fact that it's the middle of winter and the new Governor Cuomo Bridge could be full of snow. Who wants to drive out to a meeting in the middle of January? So maybe you'll always have your winter meetings virtual. I just think it's a great opportunity. One thing that is going to come out in the news in our media the end of this month that I thought I'd like to share with you ahead of time because I think it's very exciting. So you're the first peek into this. It's not confidential information, but we haven't released it yet. But I thought I want to really talk about something interesting tonight to the chapter that I haven't talked about on the national meetings. Maybe some of you took this survey, but the end of last year, we had a survey on COVID-19's impact on people with hearing loss, and most especially the HLA community. We partnered with Cochlear Americas to do this survey, and the results or the response was tremendous. And maybe some of you took this survey. And I just want to thank anybody who takes the surveys that we push out through HLAA. And many years ago, there was a research body who was surveying our membership. And the principal investigator told me HLAA people answer surveys. Like there's always a percentage that survey takers want to get for a good data study or data sample. HLA always exceeds that. So I just want to thank you because you really get in there and give us your opinion. So I just want to share a little bit about what came out of this survey. I'll tell you one thing right off the bat, which is going to be no surprise to you. And I bet a lot of this is not going to be a surprise to you. But for 95% of the people, they said face masks inhibit communication for people with hearing loss. Now, did we really need a survey to find that out? Probably not, but that really means that it's a serious issue. 95% of the survey takers know it's a serious issue. I know you probably have questions about that. Of course, we advocated with the CDC that they at least could put in their information online the option that people could use clear masks. It was an alternative choice. Of course, they haven't been approved for PPE gear in hospitals, but I just saw an interesting product today that is from a startup company of a really fancy, sophisticated piece of technology mask that protects people in very high level, and the whole front is clear and it doesn't fog up. Now, don't ask me where you can buy this because I think it's a prototype, but there are people working on these issues. They can't come fast enough, right? But a lot of these have been, these innovations in technology, these innovations have been brought on because of COVID. Here's some of the results of the survey. We look at the demographics. 85% of the respondents were 55 and up. 69% of the respondents are female. And we do see this type of trend when we look at our demographic, and you might even see it in your chapters. We had the 49 of 50 states were reported in on this survey. 52% of those with hearing loss have been diagnosed with hearing loss for over 30 years. So this was a really, I think, good sampling of our community. 77% have hearing aids and 32% have cochlear implants. And what we do know about the HLA community is we are people with hearing loss who want to use technology to stay in the hearing world. It's a big tool in the toolbox, right? So we surveyed for hearing loss and technology. 68% of those with hearing loss have increased their use of technology during the pandemic to communicate with others. 55% say that hearing loss creates challenges while using technology to communicate. And, I think we've all experienced the pain points of technology. I mean, look at tonight, just trying to get started to share a screen. We all had to get ramped up very quickly. And I really credit, our older population who said, I'm going to get in there. I'm going to figure out how to do a Zoom meeting. I'm probably going to mess it up, but I'm going to try. And, other situations were We've heard people having to go into the emergency room during COVID where everybody's wearing a face mask and they're using like voice to text apps on their phones, like Otter, to get that transmission of text. You know, it's amazing what people do when they're put in a situation and you have to be creative. So our resources have tried to really help you think of those creative things you can do. Back to technology, 45% use assistive hearing devices that make it easier to communicate. And 68% say the pandemic related increased, I can't read it because the captioning's there, I'll move it. Say that the pandemic related increase their use of technology has caused them to become more aware of their hearing loss. So that I found very interesting. Pushed in this the situation with COVID, people became more aware of their hearing loss because it became more of a problem, or maybe that's something that we can share at the end. Maybe you can input into some of these findings. So I just hit page down. Let's go. Okay. Hearing loss in the pandemic. 46% notice their hearing loss influencing other aspects of their mental health since the pandemic began. Feelings of loneliness, anxiety, forgetfulness, confusion, isolation. And you have to wonder, if we took a survey of the general public, how would this compare? Would this be similar? Because we certainly know that with or without a hearing loss, there's been a lot of anxiety. There's been a lot of loneliness and isolation. 70% of those with hearing loss say they are more aware of their hearing loss due to the pandemic. 47% say they are more eager to explore hearing loss solutions during the pandemic. And I find that as a positive, right? Take some action, find some solutions. And 52% say they feel less connected to friends and family ever as a result of their hearing loss during the pandemic. So that kind of concludes what those survey results show. And we're going to roll that out at the end of the month. We'll have, a press release. We'll have some infographics. We'll be putting this on our website and in social media. And it kind of ties into your next month's speaker topic, which I think is really interesting and exciting. Although I have to tell you, I'm not an extreme athlete like Rebecca Alexander. So you're going to get a real treat talking to an extreme athlete. I think I'm an extreme coffee drinker, if anything. So anyway, my other thing is, a big part of what HLA does is advocacy. And we do it at the national level, but you do it with your chapters, with your state organizations. You do it as individuals. Even if you're not aware that you're an advocate, you are. And I, again, tried to come up with things that I think about when I think of being an advocate. I think being an advocate shows independence. It shows confidence. It's a person-centered approach. It's not focused on an industry or a thing or a technology. It's dealing with the human, saying, this is what I need, and this is how you can help me. Empowerment, equal opportunity, accountability, and access. That's when I think of when being an advocate. Now, granted, I'm sure we all don't feel like being an advocate every day of the week. It's really hard to ask what we might need. It's hard to always show confidence and show independence. I have to admit, if I'm in a restaurant and a bad meal comes, sometimes I'm just hungry and too exhausted to say, you know what, this needs to go back to the kitchen, right? It's so don't feel badly if every single day you don't feel like advocating for what you need for your hearing loss. But it's good to learn how to be an advocate because you have tools. You have the law on your side. If you're in the workplace, your employers have to make a reasonable accommodation. So you have that conversation, how you could be helped and how you could really live up to being the best employee. But advocacy is such that big part of our mission that's carried from the national office through the state organizations, through the chapters to the individual. And I'll just talk a little bit about some of our national advocacy. But since 1979, when we were founded, we have been advocating for people with hearing loss in the United States. Now, currently, that's 48 million people. And when we go to Capitol Hill, when we sign on to a statement, when we are on the Disability Advisory Committee at the FCC, we are representing everybody in the country with hearing loss, not just people who have joined our organization or belong to a chapter. It's everyone, even if they've never heard of HLAA. And we, as I said, our community are people who want to stay in the hearing world with technology. So if we weren't there, that voice might not be represented. In fact, today, there's so many timely things I can talk about. We met with the Biden transition team, and it was just organizations who represent people who are deaf, and as we used to say, people who are hard of hearing, but people with hearing loss who use technology to stay in the hearing world. Of all the groups there today, HLAA was the only one speaking for our community. Lisa Hamlin was there, and she got to speak, and she talked about our needs for communication access. So that's just not going to help those we know, but that's for all people with hearing loss. And I love this picture because that's Lisa Hamlin on the bottom left, and she's a former New Yorker, so you can be very proud of one of your own. She's our director of public policy, and she really is the face of our advocacy program. And then on the right is Barry Kassenitz, and Barry was a former member of our board of directors. He lives in Rockville, Maryland, and he recently retired as a lobbyist for the Firefighters Association. And Barry is really terrific at knowing how to get appointments with congressmen's staff and knowing the right things to say. And we really have a good team. You all are also part of that team. Maybe not right in Washington, D.C., but you're part of the advocacy team. And here's just some of the things we do. I mentioned our COVID-19 resources. There's something called the Friends of the Congressional Hearing Health Caucus. I am the chair of that group. In the United States Congress, there is a Hearing Health Caucus. It's chaired by Representative Dave McKinley. He's a Republican from West Virginia, and Representative Mike Thompson. And he's the he's a Democrat from California. And they are two really great individuals who listen to what we have to say. And we're going to work on expanding that Hearing Health Caucus. That's my goal as chair, is to expand the Hearing Health Caucus. And in talking with their staff, they told me that the best way to get others to join that congressional caucus is to have our members in your local areas invite your congressman. So we have to find out where these people are and where all of you are in the United States and get you to ask your congressman to be part of this caucus. So give me some time to work on that, but that's down the road. Just today, we were again got our invitation to be part of the FCC's Disability Advisory Committee. And that is really important because that's where hearing aid accessible cell phones, cochlear implant accessible cell phones, captioning, caption telephone, that's where all the public policy happens, is at the FCC. And Lisa spends a lot of time at the FCC. In fact, we used to tease her before COVID and say we were going to get her a little cot down there so she could just sleep there and not have to come back and forth. But we work with Department of Transportation, TSA, airport accessibility, and Medicare. This is becoming a hot issue. Last fall, expansion of Medicare to cover hearing aids and services passed the House as part of HR 3, another bill, a prescription drug bill. This is really big. I don't think this is going to go away. It might not be the first thing in the Biden administration, but we are already there talking with staffers, talking with people, and it's on the radar. For you younger folks, when Medicare was enacted into law by President Johnson in 1964, 1965, it was meant to be a medical social welfare program for catastrophic illnesses. Well, it's evolved into something much different. The Medicare we know today, seniors over 65 all have Medicare. It's a great program. But in 1965, not only did it not include hearing aids, it said specifically that hearing aids were excluded. That's a pretty important part of legislation, and it's very hard to get something put back in when it specifically says it's excluded. But we do have some champions on the Hill, and we are working on this. We've worked on it for years, but it went nowhere. But I can actually see some hope because the over-the-counter hearing aid market, which has not opened up yet, and I'll tell you about that in a minute, that's going to kind of take care of the mild to moderate hearing loss, right? In the profound range of hearing loss, Medicare already covers cochlear implants. So when you're talking about costs of hearing aids and care, that population is now shrink, right? It's not going to be as expensive as if you were carrying, the whole range. So there's some hope in there. Just to mention the Over-the-Counter Hearing Aid Act, which was passed in 2017, by now the FDA should have come out with their proposed rules, which is open to the public. Everybody comments on them, and then the law comes into effect. They are overdue with publishing those proposed rules. We've been pushing with them. The FDA focuses on COVID, has slowed everything down. Anyway, it'll get there. It's law. I just don't have anything new to report on that, but you'll hear from me when I do. I would be remiss if I didn't talk about our Get in the Hearing Loop program. It's a national communication access program, but it is fueled by passionate volunteers across the country. Many of them are you, and really your work is admirable. So the advocacy work and the awareness work with this program really is fueled by volunteers, and we appreciate that. Oopsies. I hope I'm not going too long because I want a time for you to talk. So Steve, if I am, I'll rush it a little bit. Okay, so anyway, our Walk for Hearing, I didn't want this to go by without thanking the chapter who gets involved in the Walk for Hearing. The Walk for Hearing this year will be our 16th year. This is such an important program. It's not only, creates awareness in the community. This is where we see kids, right? We see children with hearing loss, children who come with hearing aids and cochlear implants who might have never seen another child with a hearing loss, and all of a sudden says, hey, there's someone like me. And we see the parents who come and get that camaraderie. And we see all of you. I mean, it's a fun day, right? But it's part of the community. And I think it's so important because we have the alliance groups who are part of the walk. It stretches beyond the HLA community or the HLA chapter. It reaches out to a broader group. So it's really one of our premier programs, and it gets so much participation, and it's a good time. It also is an important fundraiser that cannot go unsaid, but that's the peer-to-peer fundraising that goes on. And HLAA is a member of the World Health Organization's World Hearing Forum. World Hearing Day is on March 3rd, 2021, and this is going to be the release of the World Hearing Report. And this is going to be very significant because it's going to really underscore on the global scene that hearing loss is a serious health concern. When the World Health Organization comes out with something like this, it means something. I mean, we've had reports here in the United States, like, the National Academies of Sciences, Engineering, Medicine, but this is going to be on a global scale. And it's also going to focus on hearing care for all in underserved populations. We know here in the United States that audiology profession is largely white and female, and people who get really good care are not the people of minority communities. And so this report is going to be really great. And I love that picture of Lisa and I because we were so darn lucky. Our way was paid for by a third organization, and we went to the World Health Organization in December of 2019. And it was very exciting. It was very exciting to represent HLAA. And I'm telling you, you can all be proud of your organization. Wherever I go, our reputation is it's so good. That's not even the right word, but that's because of all of you, because of all the work you do, the work we do, the work we go together. And we're always met with such great respect and high regard. And I'm just so proud of that. And I just want you to know that you should be proud of that too, because this is your organization. But Lisa and I sure were having a good time there, weren't we? We were all smiles at the World Health Organization. It was a beautiful place. It really was. We work with people all across the world. We're part of the patient-centered healthcare network headed up by the IDA Institute. And if you looked on the left-hand side of the screen, these are the United States organizations who are involved. This network was made up of academia, patient groups, as they call them, which would be HLAA, and academia, patient groups, and professional organizations. So you see from the United States, there's ASHA was there, the American Speech Language Hearing Association, HLAA, Rush University, the University of South Florida, and Utah State University. Notice the only consumer organization was HLAA. Again, this is an honor, to be representing our community on the global level. And I could go on about more of that. Let's see. And out of that did come out of the We're All Ears campaign. Person-centered care is making yourself heard. And we do have this posted on our website as well as on the IDA Institute website. This is really our new project. I mean, you've told us technology is really important. This is our Industry and Consumer Alliance for Accessibility and Technology. It's funded by the U.S. Department of Health and Human Services under a grant, and the Research, Engineering, and Rehabilitation Center at Gallaudet University is the main contractor, and we are a subcontractor of this. And what it basically, the very high level description of this is, it's where we bring people with hearing loss together with industry to help them when they're designing their products to bake in accessibility. So we see that We're going to have a trusted tester program. We're going to have use case development. We're going to do product reviews. And this is really in its first year of a 5-year grant. And we're writing the strategic plan for this. So be on notice as we have more to report and more to roll out. We definitely will talk about this because it's a very exciting project. We also partner with other organizations. You can see many of them right there. The American Academy of Audiology, Hearing Industries Association. We're all here in the DC area, and we all have a great time together. We're on many coalitions. The audiology community has their view. The Hearing Industries Association has their view, but we all come together and partner. And one of the things that we've done for the past 2 years is the Hear Well, Stay Vital public service campaign. And each year we put out an annual report. We will be putting out the 2021 around this May, but we've also been rated top charities in Charity Raters. So you can feel very good that if you donate, your money is going to a very good charity and that we spend your money well. And I'm also very proud of that. You know, we, with you, you know, we've been able to do some really good work. And I have to say, this is your go-to person for chapters, Carla Byers-Smolin. She is our national chapter and membership coordinator, and she is there just for you. She's working on developing some chapter leadership webinars that I hope you all can join in. And if you know somebody with hearing loss, just get them to subscribe to the free HLAA e-news. It is just chock full of information. And we know as we go toward the future, our digital presence is going to be a lot bigger. And right now, our digital presence, we have touch with about 58,000 people. So make sure you're signed up for the e-news, tell a friend about the e-news, and just get that great information. And again, I just want to end by saying, you know, this is your HLAA. We work in partnership. I'm so thankful for what you do at the chapter level and at New York State. And it's just an honor to be here talking with you. And now I want you to talk because I have just talked a little bit too long. So I can stop sharing and we can open up the screen and I'll turn it back to Steve. Thank you very much.
Thank you, Barbara. And I'm sure we recognize some of those photos. It's members, it's walkers from the area, and I appreciate you including them. I'd just like to say that it's fabulous hearing what's going on with HLAA, and I know there's even more to tell. So we're all very proud to be part of this fantastic organization. It is a partnership, and we're proud to be partners with you. So I'd like to open it up, as Barbara said, to anyone that has questions for her. So please raise your hand. Don't forget to unmute your microphones if you wish to talk, and please speak one at a time.
Steve?
Yes, Debbie.
There's some question posted in the chat. If you look at the chat button.
Yes, I could certainly start with those questions. I know someone asked at the beginning about the status of Medicare. Debbie covered that. There seems to be concern, as you've expressed, about the FAA and traveling by airplanes. I'll tell you a quick story. My son, who has hearing loss and a cochlear implant, he does very well at airports, except when they make announcements over the public address system. So with all the background noise and commotion and commercials on TV sets, he can't hear where his gate is or when they're boarding. It would seem to be so easy to put it up on those electronic bulletin boards. So I'm just trying to pull up some other chat messages.
And some of the, you know, that the plane when it's flying is covered by the Air Carriers Access Act. And we've been working on captioning in flights. The ground and the terminal is covered by the ADA. And there are some terminals that do have the visual captioning. And then the airports are covered by the city. But it's really tough. It's really tough.
If any of you have been to Rochester, New York, which was the site of the last convention and is the home to RIT, it is a totally wired airport. They have looping throughout, and it's really a model of what could be in other areas. Someone had a question where Gordelet is. That's in Washington, D.C. Someone pointed out that we have a couple new members of Congress from our area, Mondaire Jones and Jamal Bowman. So they asked, how would you recommend that we lobby them to join the hearing loss caucus?
Oh, that's a great question. Give me their names again. What were their names?
Mondaire Jones, Mondaire. I know he represents parts of Westchester, and Jamal Bowman, Bowman. I believe he represents parts of Manhattan and the Bronx,
Okay.
if I'm right.
I will find out. We are having a meeting and talking about expanding the caucus. And our brilliant idea was that we would go to these congressmen, but we heard from McKinley and Thompson's staff that the best way is to have their constituents ask, which makes a lot of sense. So I will get back to you on that. And if I don't know how we're targeting and who we're targeting, but I will bring up these two names and let you know. That's great.
Hello, Barbara. How are you?
Hi, Carolyn. How are you?
Okay. They're freshmen. Jamal Jones is the freshman representative. He replaced Nita Lowry, who just resigned. So they're freshmen.
They're good. We can pull them in.
Yeah. I had a question that I posted earlier. What's the status on the Zoom? Getting personal caption on your Zoom call?
Zoom has, like everybody else, was kind of accelerated into COVID. And I have to say that, before COVID, they were beta testing captions.
Right.
So they were already in that mode. They've been really responsive. And I think that, we now see that we have captions on the paid accounts, but
yeah, but I'm not going to buy a paid account to set up a Zoom call with my friend once every 2 weeks or so. It's not something I would do regularly, but I want to stay connected. And,
absolutely.
And they've been talking about that for like a year. It's going to be 10 months now.
I think they're coming along. We're certainly talking with them. I think they just need to have a little time to roll things out. But I think with like the other platforms there, with automatic speech recognition, it's easier. It's not happening fast enough, of course, but
I use Microsoft Teams for work, and that's caption. But I was referring more to like a personal setup with friends for support,
Right,
yeah.
right.
Howard, you mentioned that Skype had captioned. Howard just put on the chat board that Skype had captioned.
Skype has captioned. So you see, they're all coming along. So I think, all these companies have been kind of hit with what the needs are, but I think that they're all going to get there.
Okay.
Maybe I'm just an optimist, but we definitely are advocating for that. No question.
Yeah, because I chat with a couple of my friends, on FaceTime. But if you have too many people on a cell phone, it's hard to read their lips because the box is so small.
Of course. Yeah, of course. And also, I've heard some people will hook up Otter as they run.
Yeah, but I don't know how to get. Oh yeah, well, you mean put it on my iPad and then have my phone for the other. Yeah, it works, but it's not that good. It's not that good. I'll be honest. I've tried them all. I even tried it at the doctor's office. I got interference and I had to pull it up again and start over, and it was just so frustrating. I'm not even going anywhere. I'm just staying home, you know. I want my vaccine so I can get out, you know, because I have an underlying medical condition also. I want to get out of the house, you know, and we're not in that group, you know. I'm surprised they don't allow disabled people to be in a priority group.
Yeah.
Every state is doing it different. Every state is doing it different.
Every state is different. I know. It's
well.
your thoughts are really they really strike some chords, Carolyn. They really do. Yeah, they really do.
But all I got to say is I'm thankful that I'm working from home 10 months now. I work in the federal court in Lower Manhattan, and
Wow.
I'm happy I don't have to commute. And
Yeah.
I didn't realize you were very involved with a lot of these agencies. You know.
Oh, yes.
I'm wondering if I should get involved because I'm not really involved on the chapter level. Maybe I can get involved in something else. I'll let you know.
I see your wheels are turning, Carolyn. You're thinking. Okay. Yeah, that's great. Those are really some good points. I appreciate that.
Okay.
Go ahead, Judy.
Did I turn it on? You can hear me? Okay. Barbara, you said something. I have done so many things with assistive listening devices in New Jersey when I was living there. And yet it's still something that could be covered with the hearing aids as well as cochlear implants. I mean, for many of us, I have a external part of Bluetooth for me to hear on the telephone. Some people would be probably appreciative in a hospital if they got a pocket talker so they could hear the doctors. These things have never ever been medical deductions. They've always been things out of my pocket. You may have heard of the Roger. I have to select. You're talking about something that's $3,200, and it's not covered by insurance. I still would like to see something like that because I know that when I was living in New Jersey, we did a lot of training in hospitals to give patients a pocket talker so they could hear the doctor talk. And some of them even stole the pocket talker because they heard so well they didn't want to give it back. So even when you're talking about the 48 million, there's still got to be people that maybe, you know, when they see people walking around with earphones on, hey, they could feel it's not a stigma. They could be part of it and still hear what's being said. So that's a minor thing I would like to see go back to talk to the FCC.
Well, that's right, because they're, you know, they kind of are, they are medical devices, and you know, insurance does cover other medical devices. They cover wheelchairs, they cover walkers, things like that. You're right. And sometimes it's just a simple solution like a pocket talker. And we're going to see, you know, with the over-the-counter market opening up, there are people out there who just want a little hearing enhancement from time to time. So there's going to be products that will help people hear when they need to hear. But insurance coverage, that's a tough nut to crack, but we don't stop trying. Thank you, Judy.
Barbara, speaking of over-the-counter hearing aids, I know there are a lot of companies that are unscrupulous, trying to piggyback on what's coming, and are claiming that they market devices that help hearing, and they do not. They may be
Right.
simple amplification devices and so forth. How do you separate those bad players from the good ones?
That's a great question. It's a timely question because there are some bad actors out there right now. In fact, I just worked with Senator McKinley's office, one of the co-chairs. He and Senator Thompson sent a letter to the FTC, the Federal Trade Commission, calling these companies out because by law, the FDA does not allow these amplification devices to be marketed as hearing aids or hearing devices, but some of them are. And when the over-the-counter market opens, there are probably going to be some very good devices, technology devices on the market, but there's going to be a lot of junk as well. Right now, I just tell people, you know, there's some bad devices out there. And if you really think that you need a hearing aid, you should get a hearing test with an audiologist and figure that out. But I think it's going to be up to HLAA when the market opens up is to provide some really good consumer information. I think it's going to be like the Wild West. It's going to be confusing for a while. Who needs what, you know? But you're right. There's some unscrupulous players out there right now that people get fooled. And, you know, you get what you pay for. If something is promoting, you know, itself $19.99, you can hear better. That's probably a warning.
John Taylor from New York City.
Hi, John. You're on mute.
Yep. I just had a quick comment about airports. When I went to the convention in Rochester, I was very excited about going to that airport because it's the poster child for looping and technology in airports. And it's true they've done all that, but I think they've missed an important part that really has to be done, which is training the staff. I found that when I was there, the staff there really just didn't know how to use the equipment, or they were using it improperly. When I went to one desk, they didn't even know they had it there. I had to point it out to them and show them where it was. When I was at the gate, there was a change in our flight, and the person at the gate is talking, but she's not talking into the phone, so it's not going up on the captioning, or not going into the loop. And so they've got all this, expensive technology there, but it's really only as good as the staff trained to use it. So that's just something I'd like to pass along. Thanks.
That's a great point, John. And I'm sure everyone's experienced that in movie theaters or theaters where they have the equipment, but the staff doesn't know it's there, or it's broken, or it doesn't have batteries. By law, when you buy a cell phone, you are to be able to test it on a live line in the store. Well, in these stores, these Verizon stores, AT&T, who's working there? A bunch of young kids, right? And they turn over really quickly. And, I went in to buy a cell phone a couple years ago, and I said, I would like to test this. He goes, oh, sure you can. And, that phone was tethered to a board, right? The phone's tethered. I said, well, how am I going to test that? And then I went on to educate him a little bit that, by law, you have to have a live phone line. It's, FCC requirement. And I didn't get anywhere, but the young man was really sympathetic, and he just didn't know what to do to help me. So he went to his manager, and the manager said, oh, no, we don't need to do that. Well, he was wrong. So I left, and I had to come back because my son needed some help with his phone. And my son was with me that whole time this was going on. And if you're a parent and you have a teenage son, they're already embarrassed, right? because you're being an advocate and they want to crawl under the counter. So my son and I go back, and the nice young man who really wanted to solve my problem and do the right thing said, hey, I told my manager all this, and I told him you're from the FCC. Well, I never said I was from the FCC, but my son really wanted to crawl under the table at that point. But, you know, you're right, John, you have people, you might have the equipment, but they don't know what to do with it. So how do we solve that? Any ideas? Ask more for equipment, keep asking, kind of forces them maybe to learn how to use it.
Now that reminds me, when we were doing live meetings, I approached the local Apple store at the Westchester. It's a big, big store. And asked them, I said, I know you have apps and you have functions on the iPhone for people with hearing loss. Would you be willing to do a class as you do various classes for the public, specifically for folks with hearing loss? And they said, sure, we'd be happy to do that. So that's something we were pursuing, and maybe folks would like to talk to their local Apple stores when they reopen and ask them if they can do the same thing. And I'm told that as a company, they are very attuned to folks with various disabilities and have developed products and specialists that can help them.
That's a great suggestion. And it kind of forces your Apple store, if they aren't well versed in all the apps, they're going to get up to speed on that. Yeah, that's a great idea.
Arlene has her hand up.
Yeah, I just wanted to follow up on that. Meanwhile, hi, everybody.
Hi, Arlene.
How you doing? Yeah, I wanted to say hi to Barbara and all these people. I was in an Apple store for something else, for my own particular product. And I was talking with the manager because I was getting great service. I wanted to compliment the person who was helping me. And we got to talking about hearing loss, because whenever you're talking to me, you're going to end up talking about hearing loss, right? And the manager said that they wanted to do workshops for, and among other things, their features that help people with hearing loss, but they didn't know how to get people to come to them. So I said, well, I'll put out a notice to, I'm New Jersey, and I put out a notice, and we had about 8-10 people come to the Apple store in Garden State Plaza in Paramus, and they ran a workshop for all the features of their phones and computers that would help people with hearing loss. So that's telling me that the managers are doing that. They have that as a resource. So tap into that. That's not something you just invented, although it's a good idea. They already know about this. They just don't know how to do it. They don't know how to find the people. And it worked out really, really well. And that was just a one-shot deal. But the Center for Hearing Communication, what used to be the League for the Hard of Hearing, they honored Apple at one of their galas a year or two ago for being very proactive about hearing loss. I'm not sure if it was just their Lower Manhattan store or whatever, but definitely follow up with Apple. They do want to do that. And there is a whole bunch of new stuff coming on, because I know my cochlear implants, Advanced Bionics, they're just releasing new ones that are going to have Bluetooth. And, you know, all the phone calls are going to go straight into my brain. And this is happening in other of the devices. And so this also dovetails what the Apple and the other companies are doing. So yeah, if you really want to do it as a leader of your chapter, definitely open that up to them, or they might even, you know, come to your chapter meeting, just invite them on here. So, yeah,
I was just
not
gonna say,
something that's out of the question.
the word pivot. Why don't we pivot on Zoom instead of in person? Maybe we can have an Apple representative do a presentation for a Zoom meeting.
I
Perfect.
will reach out. John, I think you had your hand up, John Taylor.
Yeah, just to mention that a couple of years ago, the Center for Hearing and Communication in New York had a representative from the downtown Apple store came and did a workshop that was actually very, very good. It's good advertising for them. They should want to do it.
Mhm. Absolutely. I had a comment to make about our chapter and our challenges, and I think other chapters can probably relate as well. We're always trying to increase our membership, bring them great topics and speakers, and just get the word out about the great work that we do. So the challenge is twofold. We'd like to partner with audiologists, hearing aid dealers, ENTs, and other professionals in getting the word out. However, they don't always seem to be too receptive, and we can't figure out the best way to do that. The second observation is that everyone doesn't like virtual meetings. We're sort of a generation, my wife calls us digital immigrants versus the kids are digital natives. They were born into it. So how do we reach out to some of the more mature members and bring in some of the new members at the same time? So these are the challenges we're having, and I hope I didn't ramble too much.
I think you're not alone there, Steve, and it would be great to have a chapter leadership workshop, maybe share some ideas, but you could invite audiologists to be speakers, hearing aid specialists to be speakers. You know, they don't realize, but an HLA chapter and could really help them do their job, right? They fit the hearing aids, and this is where people get more information and more support that the audiologist can't give. And some are really in tune to that and some aren't.
Absolutely.
Yeah.
Karen Rogers, you have your hand up.
I just want
And
to
then
say
Mary.
Mary's been waiting to be called on, so have Mary talk.
Okay,
Go
Mary
ahead,
Whalen.
Mary.
Mary.
Yes, thank you. Actually, my question is related to both Steve and Arlene's. I think that ultimately all of us would love to meet again. That's our preferred means for most of us, but there's something to be said about virtual meetings. And I can't help but wonder, I was thinking about your comment about older people being less inclined to technology. And I think that there may be research on it that I am not aware of, but I think that there are a lot of older people that actually are technically inclined, but that maybe there are other reasons why they may not come to an in-person meeting. All of us who have hearing loss that has developed over time know that we change socially. We're a little bit more timid to attend certain things because we know we don't hear as well as we used to. We don't want to ask the wrong question or answer the wrong one. And I think that also brings up the question for an older population especially, but also people who are shut-ins, who have mobility issues, people who may be deafblind, people who are caretakers. These are all people that may want to really come to a meeting, but they know that they could never do it in person. And I think that maybe if they can find a way, we can find a way to reach all of those people. Maybe it's not through audiologists all the time. we know already that there are a tremendous amount of people who need hearing aids or cochlear implants and don't have them. So we have this entire population that is not really mainstreamed with the rest of us who have acknowledged our hearing loss. So, you know, I'm not sure if I'm really asking you a question or asking you to maybe consider that there are a lot of people that need help, that maybe they could do this in baby steps. I'll just give an example. A caretaker with a hearing loss may not be able to come to a meeting, but they may want to try it on for size just by coming to a virtual meeting and seeing if it's something that could work for them. They may want to get involved. You know, I just think that there are a lot of people we're not reaching because maybe they're not going through the channels that we're looking at. Maybe they don't go to an audiologist. Maybe they're not acknowledging their hearing loss. Maybe they don't really understand what cochlear implants are. So even though they don't have a lot of knowledge, we have to find them somehow. And maybe we could start with continuing on with virtual and in-person when that time comes. It's just my thoughts.
Mary, I just want to say, I think that you're seeing the virtual meetings as an opportunity to reach people, even thinking of young parents who there's no way they could get out to a meeting during the week. And just last week, I mean, this seems something so simple, we should have done it before, but when you go to our section on the website and it says find a chapter and all the chapters are listed, we just put up at the top, some of our chapters are holding virtual meetings. Contact the leader directly to see if there's an opportunity that you can join one. Something small, but you know, it might open it up for somebody who wasn't able to come.
Yeah. I think it can really be a wonderful opportunity to reach a lot more people. I guess that's what my point is. Thank you.
Thank you,
Arlene
Mary.
had her hand up. Arlene?
I have a contact for you. Every day, I get an email from the JCC on the Palisades, which isn't that far from Westchester. It's for their seniors. It's specifically for their seniors. So these are seniors that are tech savvy enough to get emails. And every day it's exercise Zoom and a speaker and all sorts of information geared to seniors every single day, okay? And I'm just thinking, talk to them and stick your meetings in there, okay? Because one day, okay, we may meet in person, but from Palisades, you know, it's up in Tenafly. So geographic doesn't have to be close geographically, could be anywhere in the world, but just for the comfort zone, it's not that far away from Westchester. But you probably have some other Ys or JCCs that are doing this for seniors, because I know the JCC in Manhattan also has every day for seniors online activities. Some are Zoom, some are recorded, some are live, speakers, bingo, you name it, everything, a full program every single day. And so that's like ripe for the picking right there, because tech savvy, older, no doubt some of them have a hearing loss, no doubt some of them have hearing aids or need them. And you may just put yourself on their calendar and there you go, it's free.
Richard, you had your hand up before, Richard Sussman. And then Judy.
Okay. I hear everything you're saying.
Richard, you have to unmute your mic.
I've been reading everything. I want to include that
Can you get some
very
water?
isolated.
Hi, Barbara. We met briefly in Rochester. I read I heard your answer about hearing aids. I didn't know that there was a legislative roadblock in the Medicare legislation. But should this you know, 50 years later, should this be a meaningful obstacle? I mean, there are a lot of people, I don't know how many people there are like me who wear a hearing aid and have a cochlear implant. And it's it's just logistically, I just wish that, you know, there are a lot of things that people who have cochlear hearing aids are taught to do to maintain their hearing aids, whereas you can't really maintain a cochlear implant, even if though you can try to maintain your sound processor. What isn't there a political process, or can you envision a political process where we could get hearing aids treated the same way as medical devices?
Oh, yeah. Yes. And that's what we're working on, Richard. This hurdle is not insurmountable because we know so much more about hearing loss now. We know that comorbidities are associated, falls, isolation, anxiety, the cognitive link that is being studied even more with dementia, and hearing loss is a primary health concern. So back in the 60s, it was almost like, well, hearing loss is something that just happens when you get older and don't worry about it. But that thinking is long gone, long gone. So we do have that, and a lot more data, a lot more research. And, every new thing in Medicare has to be what they called scored by the Office of Management and Budget. And they've actually gone to the point of putting a score on it. And the fact that the over-the-counter market will open up and take care of part of the people, it's realistic. And we've actually worked on language for the Medicare bill. And it could be that Medicare will cover a basic hearing aid. And if you want something with bells and whistles, you can buy up. That is probably, to make it affordable, but it's not insurmountable, and we're working on it. I'm very hopeful. I mean, it's not going to happen next year, but I'm very hopeful, much more than I was 10 years ago.
Well, I'm wearing a hearing aid with bells and whistles, and it was recommended to me by my audiologist because it is compatible with the cochlear implant that I subsequently had surgery to install. And the point is that while it has I can do things to maintain it. For example, if it gets wet or something like that, there are occasions when there's no home solution and I have to bring it to an audiologist or an audiology clinic, and they have to charge me whatever the market demand creates for the work that gets done. And because they won't get any reimbursement from Medicare, even though they work with people who are on Medicare and who have cochlear implants, and they're happy to accept the Medicare reimbursement for those.
You should ask about COVID, if anyone's heard of COVID symptoms. Richard.
Judy, you had a question?
No, it has nothing to do with what Richard said. I'm just gonna go back to Barbara. I also like to add, consider more captioning in meetings all over, because when I moved down here to Virginia, my children, I moved into an active citizen complex. I fought constantly. It's one thing to be hard of hearing or deaf, but on top of all of that, I moved here to Virginia. I can't understand the Southern accent. Everybody laughs about that, but also it's one thing, but I can't lip read a Southern accent either. As soon as I come to New York, I'm happy again. So I think it's something that has to be for everybody. That just,
Well,
I did a paper at college about if you're using captioning, that even foreigners will learn English better because they can hear it and see what you're saying. And it's the same thing. I understand that people live here, but if certain people in North Carolina, they can't understand. But they just next to it.
and that's Judy, that's really important point, because with automatic speech recognition, which you're experiencing now, if the speaker speaks clearly, does not have an accent, it's near perfect. So, there's a lot of research and development that's going into automatic speech recognition, and it will get there someday. It will get better and better, but right now it's just not perfect. If somebody has an accent, they have a soft voice, or they're not speaking clearly, it doesn't pick it up.
Too bad we can't get some of the men to take off their beard and mustaches.
Someone asked the other day, I'm not sure if it was in your meeting on Saturday or our board meeting last week, whether these speech programs like Zoom are intuitive, whether they learn language and improve themselves. I'm looking, every time you say COVID, it misspells that word. So there's no artificial intelligence in here, coded, CODED, rather than COVID.
Right,
So,
it's not self-correcting, right?
correct.
I honestly don't know the engines that fuel automatic speech recognition, but that would be an interesting topic if we could get somebody to talk about the development and what it does and what it doesn't do. I think that'd be a great topic for a webinar. Thanks for that idea, Steve.
Here's another one, but Karen Rogers, you have a question? No? I'm wondering if anyone has done a study of the cost to society, the cost to taxpayers of people not being able to hear or have marginal hearing, and what that means in terms of unemployment, underemployment, and all the assistance that's required, often at taxpayer expense, versus the cost of a $3,000 or $5,000 hearing aid. I would think the cost of that hearing aid is a lot less than the cost to society and to taxpayers in the long run.
Right, because there are studies that people with disabilities are underemployed. And there's a percentage tied to that. I just can't get it off the top of my head. But I do think that there are studies on the costs of not treating hearing loss. I would just have to look some of those up. I don't have them at my fingertips.
Okay. If no one...
Giving me a lot of homework, Steve.
Sorry about that.
That's okay.
Okay. We want to thank you again, Barbara, as we
pleasure.
do at the end of all of our meetings. We open up the microphones and encourage you to stay on the line for a little bit to socialize, because it's not all learning and education. We want to have fun and enjoy ourselves and get to know each other better if we don't already know each other. So please stay on the line. Again, raise your hands, unmute yourself if you'd like to speak. Before we get to that, I'd like to say we do have a brand new website at HLAA Westchester, and that is hlawestchester.org. And I'm told that we get about 10,000 hits a month on our website. So someone is Googling hearing loss in Westchester and hopefully finding out about our meetings and other services. So if you like what you saw and heard today, please do invite your friends, relatives, coworkers, and others with hearing loss to join our next chapter meetings. You can find that information on our website that I've just given. If you have any questions or comments, we have an email address, HLAA Westchester @gmail.com. So again, thank you for joining us. And anyone have any thoughts or comments?
Steve, hold on.
Debbie.
There's another question in the chat. Can
Okay,
you look at it? It's from Angela. She's asking about health insurance for
sure.
some companies, if you can look at that.
All right. Is all health insurance should pay for hearing aids and cochlear implants?
Yeah, that's her question.
Okay.
They already pay for cochlear implants.
They pay for cochlear implants, and I found out they pay for it because they classify it as a durable medical device. And they
I
knew
think
that
they
20,
probably
30 years ago.
overpay.
Okay.
I
We're
mean,
talking
when I
about
had
hearing
got my
aids.
cochlear implant, I was given a bill for for $300,000, of which I had to pay $300. And I don't know, some of that went to for the hospital and the surgery, but a lot of it was for nothing. I mean, nothing that affected me. It seemed like feather bedding, and if that's not the right term. But I think with hearing aids, it's a lot simpler, and many people are greatly assisted by hearing aids. Before I had the cochlear implant, my hearing was greatly assisted, and I even rely on the hearing aid to listen to my telephone calls on my iPhone, and so now with the cochlear implant, I can hear what somebody's saying. Somebody can walk into my office, I can hear what they're saying too. That was a revelation. Barbara, I just wanted to thank you for coming to our meeting, and I guess we'll see you online at our virtual convention, which I don't think you mentioned a date for.
It's the end of June, around June 25th. We are just now working on getting that all posted on the website. So, there's so much to do. You have a very small but mighty staff at that national office.
How many people?
We rely a great deal on you guys. You guys are doing a great job.
Barbara, how many people actually work at the national office?
I want to say 11.
Okay.
11 people. Yeah.
Tremendous amount of work for 11 people. I would have guessed 50, 100 people.
Oh, no. And then we have a full-time volunteer who's Hollis, who is on this call tonight.
Mm-hmm.
And actually, we've all been working from home. I go in about once a month, or maybe twice to maybe sign some checks or something. But Hollis goes in every single day, and she keeps the mail going and takes care of everything. Put it that way, everything. So I just want to thank her publicly. So we have 11 staff, and we have one very dedicated full-time volunteer who I couldn't even afford to pay what she's worth.
Well, thank you. Thank you, Hollis. And thank you, Carla, and all the other people that we interact with.
Yeah.
We really appreciate it.
No, we appreciate you. We really do. You're one of our long-standing chapters. You've done great work and in Westchester County. Really, we all appreciate it.
That's nice to hear. Thank you. All right. So we passed the time that we normally end our meetings. So if anyone has anything else to say, otherwise, I wish you all a good evening. And anyone who I haven't already wished a Happy New Year, Happy New Year to everyone.
Thank you, everyone. Thank you.
Bye now.
Steve,
Yes.
is the captioning, is the automatic captioning?
It is automatic captioning that's part
Oh.
of the paid Zoom service.
Oh, okay, so
I'm
you're not, you
using
don't have,
my,
you
I'm
don't
using
have
my
a card.
work. Yeah. They have basic free service that limits you to a certain number of participants and 45 minutes of time.
Yeah, I know.
And this is a paid service. It's not terribly expensive. It's about $150 a year or $15 a
that?
month.
Yeah,
And,
but like I said, I knew that once every 2 weeks, 3 weeks, to talk to friends. It's not worth spending that kind of money. Yeah.
Sure.
So that's why I was asking. It was pretty good. I mean, for an automatic captioning, I wasn't sure if you were using the card.
We were using CART and we were
Yeah,
spending
I
a
know.
lot of money for CART.
Oh yeah. Oh
The
yeah.
majority of our budget goes towards CART.
Oh yeah. You're
Good,
saving a
as
lot of
well as-
money.
as
You're
well as the
saving a lot.
scholarships and other things. So we're saving a lot of good money that we can put into other things. Good
Right.
point.
Right. Hi,
All
Mel.
right. Again, thank you, everyone. We'll see you soon. Our next meeting is on February 11th.
With Rebecca Alexander.
Yes, we'll send notification out. Thank you
Hi,
again.
guys.
Have a good evening. Thanks,
Thank
Roy.
you, guys.